Michael Jackson, 50 years old, the king of pop, has died. A very, very sad moment.
Michael Jackson's death shocked the world. But did you know it was caused by a powerful drug only meant to be administered by a licensed anesthesiologist? Hi everyone, Dr. K here, your friendly anesthesiologist. Welcome back to the channel. Today, we're diving into the controversial death of Michael Jackson and the powerful drug propofol, which played a critical role in his tragic passing. As an anesthesiologist, I use propofol every day, and I want to shed the light on how this drug is typically used, why it can be so dangerous outside of a medical setting, and how it contributes to the death of the king of pop. Let's start with some background. Propofol is a powerful anesthetic used primarily for inducing and maintaining anesthesia during surgeries. It's known for its rapid onset and short duration of action, which makes it very effective in controlled environments. It's also used in smaller doses for sedation or a minor procedure such as colonoscopies or in intensive care units to keep the patients comfortable while they are on the ventilators. However, it's not a drug to be taken lightly. Propofol requires continuous blood pressure monitoring and respiration monitoring because it can quickly suppress your breathing and lower the blood pressure. That's why it's administered only by medical professionals trained in anesthesia who can monitor and manage any complication that might arise. Michael Jackson was using propofol as a sleeping aid, which is extremely dangerous. As everyone knows, he suffered from chronic insomnia and had been using various sedatives over the years to manage it. Propofol is not approved or recommended for treating insomnia, and using it outside of hospital settings is exceptionally risky. Jackson referred to propofol as his milk due to its milky white appearances. He became dependent on it for sleep, likely because he had developed tolerance to other sedatives and believed that only propofol could help him achieve the rest he needed. Dr. Conrad Murray, Michael Jackson's personal physician at the time, administered the propofol. This is where the things start to get concerning from a medical standpoint. Dr. Murray, a cardiologist, not an anesthesiologist, and lacked the specialized training to manage the administration of such a potent anesthetic outside of control and monitored settings. Administered propofol in a private bedroom without the necessary monitoring equipment and emergency support was not only unethical, but reckless. Jackson should have been continuously monitored, ideally with a specialized equipment that tracks breathing, oxygen level, heart rate, and blood pressure. And Dr. Murray should have had resuscitation equipment readily available. However, none of this seemed to have been taken place. As an anesthesiologist, I know that any time you administer propofol, you need to be prepared for respiratory depression, or simply put, the patient can stop breathing. That's why we closely monitor patients in a controlled settings, ready to intervene at the first sign of a trouble. Reports indicate that Murray left Jackson unattended after giving him propofol. Jackson went into the respiratory arrest, meaning he stopped breathing. And by the time Dr. Murray found him, it was too late. Attempts to resuscitate him failed, and he was pronounced dead shortly after. According to the autopsy report, the official cause of death was acute propofol intoxication, with benzodiazepine effects contributing. The medical examiner concluded that Jackson's death was the result of a combination of drugs, primarily propofol, which was administered in the settings that lacked the necessary safeguards. Propofol alone can be fatal when not used properly, but combined with benzodiazepine, sedatives that can also suppress the respiratory system, the risk is exponentially high. Michael Jackson's death is a tragic example of the dangers of misusing powerful anesthetics like propofol. As an anesthesiologist, I cannot stress enough the importance of administering these drugs only in a controlled settings by trained professionals. Even with these precautions, propofol requires constant vigilance and the ability to respond immediately to any adverse effects. Michael Jackson put his trust in a physician who unfortunately did not uphold the standards of care necessary when dealing with such potent medication. It's a reminder of how important it is to seek care from qualified professionals, especially when dealing with drugs that carry life-threatening risks. If you found this video informative, please give it a thumb up and subscribe for more medical insights on high-profile cases. And also, leave your comments down below, maybe other topics that you suggest for me to cover. And thanks again for watching, and stay safe out there.